Thank you for joining us for this Fox 13 News special presentation. I'm Bob Evans. The COVID-19 pandemic has brought so many of us together in an effort to not just survive this difficult time, but to actually come out better on the other end. But it has also highlighted some troubling situations. Tonight, the Fox 13 Investigates team has 3 stories related to accountability in the COVID-19 era. Fox 13's Ben Winslow examines how the state is investigating dozens of companies that are making false claims about the effectiveness of their cleaning products against the virus.
And you got to read the label. It'll tell you how long to leave that product on there.
Fox 13's Adam Herbets digs deeper into outbreaks at several Davis County businesses and how some are being more transparent than others.
I can certainly understand why many CEOs would not want to have this conversation.
But we start with Fox 13's Nate Carlisle, who is getting answers about the government agency that's supposed to hold businesses accountable for putting workers at risk for contracting the virus, and how that may not actually be happening.
What were the concerns you had about what was going on at your workplace?
Both myself and my wife are immunocompromised, and so my biggest concern was with the social distancing requirements and lack of physical barriers in a retail space.
This retail worker asked we not reveal his name or face for fear of losing his job. Records confirm he was one of many Utah workers who reported his employer to the Division of Occupational Safety and Health.
I was kind of looking for more guidance on how we could better meet the requirements and how I could be protected and protect my family from something that is much more life and death in our situation than it is for a normal family.
Most of the complaints to Utah OSHA are specific. Many bathrooms are not in working conditions and are running out of soap, read one complaint in April warning of problems at a FedEx facility in North Salt Lake. The Davis County Health Department later said there had been 12 infections there. One person in June complained employees of Burton Lumber in Salt Lake City were testing positive for the virus and not quarantining, and employees there weren't wearing masks either. The Salt Lake County Health Department says 16 workers at Burton Lumber have tested positive for the virus. A representative of Burton Lumber declined to comment. And Utah OSHA received multiple complaints about conditions at Salt Lake City International Airport, where the state health department has reported at least 287 infections among airport employees and construction workers.
I think this system is pretty under-resourced.
The complaints aren't necessarily unusual, even in a pandemic, says Lauren Skolnick, an employment attorney in Salt Lake City.
When employees are complaining about insufficient PPE, complaining that they don't have running water, there's not soap provided, those are things that OSHA would look at.
Yet Utah OSHA has only inspected 4 businesses where an outbreak occurred. One of them was the JBS beef plant in Hiram, where Utah OSHA found 441 infections and that one worker died from COVID-19. That inspection did not result in any penalties against JBS, nor have the 3 other pandemic-related inspections by Utah OSHA resulted in any citations or fines. In Colorado, OSHA has proposed a fine of more than $15,000 for a JBS meatpacking plant in Greeley, where 6 workers died after contracting COVID-19. In that case, OSHA found inadequate protections for workers, and the plant did not properly log injuries. In a few cases, Utah OSHA contacted the employers and worked out the issues without an inspection. But in nearly every other instance, Utah OSHA referred the complaint to a health department, according to the log.
This is a first-time thing for all of us.
Utah OSHA is overseen by the state's Labor Commission. I asked its spokesman, Eric Olson, why there had been so few pandemic-related inspections.
First, we're going to look who's making the call in, right? It needs to be a current employee or an employee representative, like a spouse or a union representative or even a parent that calls and makes that complaint. It can't be an ex-employee that's angry because they got fired and they're trying to get somebody in trouble.
Olson said Utah OSHA is not sure what it's supposed to be looking for.
Rules and regulations on the state and federal level regarding COVID, there aren't any yet in place for us to follow.
But U.S. OSHA, which has oversight for how Utah and other states run its worker safety offices, has created a webpage dedicated to telling its compliance officers what the standards are. Federal OSHA has used existing rules to cite 112 employers across the country for many of the pandemic issues also reported by workers in Utah. For example, in Connecticut, which has a population only about 10% greater than Utah's, OSHA has cited 7 employers.
OSHA has broad discretion as to when it might do an investigation.
When we do see something that would qualify as a public health hazard, then we'd pass that on to the Utah Department of Health or a local health department for them to at least take a look at it.
It's not clear where those referrals are going in Utah. Spokespeople for the State Department of Health as well as the health departments in Salt Lake and Utah counties all say they have no records of receiving referrals from OSHA. One of OSHA's roles is to investigate workplace deaths. Both Olson and the spokesperson for the Utah Department of Health say there's currently no mechanism for notifying Utah OSHA when someone contracts COVID-19 on the job and dies.
It's a hard one to pin down on just one agency.
Jeff Worthington represents manufacturing and transportation workers as president of the Utah AFL-CIO. He believes OSHA could do more inspections, but also wants state and federal politicians to set more specific rules for protecting workers from COVID-19.
But it's hard to take a state agency like OSHA and say it's your fault that this happened at this meatpacking plant when we don't really have strict guidelines.
I think the real detriment for workers is that they really have nowhere to turn. I think they tend to throw up their hands.
We would hope that employees would bring that to our attention. But if there's not a specific statute, maybe there's something else we can look at that can help make that a safe workplace, because every employee deserves a safe workplace.
I heard nothing.
The retail worker we spoke to says OSHA referred him to the health department and took no other action on his complaint. His employer eventually let him work from home, but he says his boss can change that decision anytime.
I am absolutely dissatisfied with OSHA and most of the regulations that have been put in place for worker protections and protections in general.
Fox 13's Nate Carlisle joins us now. The thing that I take away from this is 150 complaints, 4 inspections, but no citations. What is a worker supposed to do if they have a complaint? I mean, reporting it to Utah OSHA, I mean, does it do any good?
Well, OSHA does still want the complaint. So if a worker is concerned about health and safety in the workplace, then they, go ahead and make the complaint to OSHA. You can do so on Utah OSHA's website. There's a form. There's also a hotline. That number is also on Utah OSHA's website if you can find it. The other things you can do is Lauren Skolnick, the attorney in that piece, suggests employees band together, perhaps with a petition to take to the employer. Jeff Worthington, the union leader we saw there, he suggests going to Human Resources, letting Human Resources know about your concerns.
Do workers have to worry about retaliation at all? I mean, what if that's a concern?
That is always a concern. There are laws that are supposed to protect workers if they do make a complaint to OSHA, and there's actually a whole separate process that can be followed if there is retaliation against a worker in that case.
And finally, what about workers being able to sue their employers over this? Is that a possibility?
It's possible, but it's difficult. Back in May, the Utah legislature passed a new bill that raises the standards under which you can sue an employer. It's even harder to sue an employer now over COVID-19 than it would be for a normal workplace injury. And then there's a whole separate problem is you'd have to be able to demonstrate that you got sick on the job, and that can be difficult sometimes.
All right. Fox 13's Nate Carlisle, thank you very much. Still ahead, how is COVID-19 impacting Davis County and some of its largest employers? We'll take a closer look. And sanitizing products have been flying off the shelves during the pandemic, but some of them may not work as advertised. See how the state of Utah is getting involved. Accountability in the COVID-19 era means more than just relying on the government to flatten the curve. Utah is trying to stay safe, to stay open, but are private businesses doing everything they can to operate responsibly? Fox 13 investigative reporter Adam Herbetz takes a closer look at outbreaks in Davis County.
This is Davis County, the suburbs, Utah's 3rd largest county by population, facing the 3rd largest number of COVID-19 cases.
This pandemic has been absolutely a challenge.
We've just had to work through it just like everyone else.
Unlike its neighbors, Davis County does not have a major downtown, a homeless shelter, or a university. Instead, the health department says workplaces are some of the most obvious spots for community spread.
Adam, it's because every business is vulnerable. There's not a business that's going to be immune.
For the past few weeks, Fox 13 has been analyzing Davis County outbreak data, showing the total number of employee infections per business from the beginning of the pandemic through late October.
Well, we appreciate you coming to visit us here at Lifetime.
When we asked businesses to explain what happened, some were more transparent than others.
I can certainly understand why many CEOs would not want to have this conversation.
Lifetime Products in Clearfield is the Davis County business with the largest number of infections, 47 cases.
We have not had anything that I would classify as an outbreak at all.
The company's CEO says you have to put the numbers in perspective. Lifetime is one of the largest employers in Davis County with about 3,000 workers and less than a 2% infection rate.
Davis County is our global headquarters, so we're very, very concentrated. So when you look at any number, you have to ratio it against what's the whole. 1 or 2 people out of 10 is a really big deal.
Lifetime in particular has done a great job of being proactive.
Lagoon Amusement Park, another large employer with a similar amount of employees, comes in second place with 28 infections.
We're a company struggling through a pandemic just like all the other companies are.
And they've done a great job in containing it.
Lagoon says it has less than a 1% employee infection rate, but it's unclear how many customers have contracted the virus.
Very, very poor design.
Some are upset with the lack of social distancing or people wearing a mask inside the park.
Everyone was super crammed. It was just bad. I think they're trying their best.
They said if we're not in line, we don't have to wear them.
There's a public health order from the governor.
And I technically have medical exemption. And so.
Very good.
Then there are small businesses like California Packaging. 26 infections out of, according to a manager, 104 employees. That's a 25% infection rate.
I don't understand how they get so many of them.
This manager had no comment, but an employee tells us he's surprised because he feels like California Packaging does a good job keeping things safe. He also says he was not notified of the outbreak, which took place in August.
We had already had things in place that we thought would work.
Michael Arviseth is the CFO of Bailey's Moving and Storage. He says they have about 130 employees, that most of their 21 cases were discovered in June, and that he doesn't know why the company had a 16% infection rate.
Most people didn't have any symptoms at all, or very, very minor symptoms. We tried our very best. We had procedures in place, and we improved on those procedures. And since then, we have been essentially at zero.
The Davis County Health Department says 2 other small businesses have had 20 employee infections. The first is UST Corporation in Layton, which had no comment.
You just going around to different businesses randomly?
We're going to the ones that had the highest number of employee infections.
Oh, okay. Well, thank you. Sorry.
Yeah.
See ya.
The second is Zero Manufacturing in North Salt Lake. Employees there did not answer their phone, their email, or have their lobby open to the public. According to the Department of Workforce Services, both UST and Zero Manufacturing have between 100 and 249 employees.
I would not say that we have any business that has been a problem. We've received hundreds of complaints since the beginning of this outbreak about businesses. We have not issued any violations.
Fox 13's Adam Herbets joins us now. And Adam, this is the second story now in this presentation, this special broadcast that we're doing, where a government entity, in this case the Davis County Health Department, has received numerous complaints but has issued no citations. How do you explain that?
Yeah, my takeaway from speaking to the director of that health department, it takes a little bit more than just filing a complaint to have them send an investigator out there to go inside the business, as we tried to do, to look at what is going on behind closed doors. Of course, to file a complaint, you don't necessarily need any proof. Anybody can file a complaint about any business. You could file a complaint right now sitting at home about Fox 13. That doesn't necessarily mean somebody's going to come in.
Please don't do that.
Yeah, please don't do that. But once the burden of proof is a little bit higher, that's when they actually take the time to send somebody to come out and see what's going on. And in many cases, it's just recommendations. Other than that, they're just going to pick up the phone and call the business to see what's going on.
And when they call that business, what happens? Do they talk to somebody in charge, or what happens?
I think they ask questions. They want to know what are the struggles that businesses are facing right now in the middle of this pandemic. We realize this is a virus that doesn't discriminate, which is why when we speak to some of these businesses, they tell us, yeah, our infection rates are a little bit higher compared to other spots in Davis County, but sometimes it's just a matter of luck.
And then based on that phone call to the business, then the health department determines whether they're going to investigate, correct?
Correct, yeah. If they are not exactly happy with the responses they're hearing on the phone, they realize that perhaps they aren't practicing social distancing or they aren't practicing having employees wear face coverings, then they're going to go and say, okay, you need to make these changes.
And real quickly, because we got to wrap here, if you got turned away from several businesses, does that imply that there's something wrong going on there?
Not necessarily. Of course, these are private businesses. They don't have to speak to the media. Although I will say the businesses that did have us come in and take a look, they all were doing things, practicing social distancing, wearing masks, anything you would expect from a business in this pandemic.
All right. Adam Herbets, thank you. Still to come, dozens of Utah businesses are being accused of misleading customers. We'll show you how the state is holding them accountable. Welcome back. The state of Utah is actively investigating dozens of companies making false claims about their products and COVID-19. It involves everything from hand sanitizer to disinfectants. Here's Fox 13's Ben Winslow.
What we've found since the beginning of the pandemic is a very large increase in the use of disinfectants.
People are relying more and more on disinfectants and sanitizers to keep their homes, businesses, and schools safer from COVID-19. Utah's Department of Agriculture and Food actually has regulatory oversight of those things because they're technically a pesticide.
We've been looking at these products and making sure that they're legitimate, that they're legal.
The state's pesticide program manager confirms to Fox 13 at least 24 companies are under investigation for making false or misleading claims.
There's a lot of products out there that are saying that they're effective against coronavirus and that they have a long residual, weeks, months. The fact is, painfully few disinfectants actually will last beyond the period of time that they're wet.
The agency won't name the companies, but says it will work with them to bring them into compliance. Some could face criminal charges. They also warn that consumers should be aware and check to see if the products they buy are EPA certified and follow the directions clearly.
We've done inspections with several institutional users where there's a lot of traffic going through their facilities, and we're finding that oftentimes the crews will just apply the product and wipe it off. There's this idea of a wet time that's critical, and you got to read the label. It'll tell you how long to leave that product on there wet before you wipe it off. If you wipe it off too soon, it's not effective.
Joining us now is Fox 13's Ben Winslow. Ben, this is a bit disturbing. I mean, how can people be sure that what they're buying is safe and effective?
Well, there's a few things that you can do as consumers to ensure that you're getting what you're paying for. The Environmental Protection Agency actually maintains a list of disinfectants, sanitizers, and things that have basically passed muster, that they're safe to use. And we do have a link to that list at fox13now.com. It's really helpful. You can search by brand name to make sure it's been tested. Also, if you're buying hand sanitizer, make sure it's at least above 70% of the alcohol content. That way it can actually kill germs. The Department of Agriculture and Food will also go out to businesses and institutions and then do inspections to make sure that people are applying these disinfectants the right way, because that's another concern, is people may not just do that, may not put that out there and apply it, and it just doesn't work.
Yeah, one of the things that we just heard was that if you don't leave it wet on the surface for a certain amount of time, it isn't going to work.
Exactly. That's why they're at least offering this as a service for businesses to do.
Now, Ben, even more disturbing are today's record-breaking numbers. I mean, they're very alarming. What is the state going to do about that?
Horrifying is, in fact, the word I would use. The governor has been holding emergency meetings with the Department of Health, his COVID-19 Unified Command, and Republican leaders here on Capitol Hill. The governor threatening the possibility of more restrictions, but legislative leaders seem reluctant to go there. The governor has planned an announcement for next week. They are also discussing deploying more rapid testing to universities across the state to try to maybe get an idea or a hold of this asymptomatic spread.
Boy, and in the meantime, we all have to do our part. Fox 13's Ben Winslow, thank you so much. If you have a story you'd like the Fox 13 Investigates team to look into, send an email to iTeam@fox13now.com or call the tip line at 801-536-1314. Thank you for watching this Fox 13 Investigates special report, Accountability in the COVID-19 Era. QuickCast is up next.